Hi, welcome to Nutritional Blood Chemistry. This is an infertility case study. I'm Laura Sheehan. I want to talk about Martha S., a 25-year-old female. She first came to my office April of 2022 with chief complaints of abdominal swelling, sore feet, and a lump on her chest. She had had one miscarriage in the first trimester and was concerned about fertility. Here's some more about her background. Martha is Amish. She works on the family farm. They are dairy farmers, and she has a demanding daily schedule. She has to milk the cows twice a day and hours of barn chores. She regularly has to take care of animals like cows, horses, and chickens. So I got right to ordering lab tests. I suspected underlying imbalances, so I ordered the Sheehan standard panel through Avexia. So the standard panel currently includes over 70 biomarkers, such as a thyroid panel, a complete thyroid panel, an iron panel, inflammatory markers, nutrient markers, and metabolic markers. The Avexia advantage is that the panel is very cost-effective to run the labs. It's up to an 80%, maybe sometimes more, savings over traditional lab costs. And you can order through Avexia as a non-licensed practitioner. I don't have to do that. I'm not licensed. I have a master's degree, and I'm also certified to practice nutrition response testing. However, my husband is a chiropractor, so he can order the labs, and I work with him. So that's how I do it. But if I wasn't, I would be using Avexia's internal physician network to order the labs. It's a very small additional fee. So interpreting the results with NBChem tools, nutritional blood chemistry tools. Here is the Sheehan standard panel. When I show this to a patient, I tell them when the raw scores come from LabCorp, they flag certain numbers if they're out of range. And the numbers that are out of range, I make them orange on this chart. That means they're out of the lab range, so potentially pathological, like medical. However, most people that come to see me, they don't really have any pathology that you can point to clearly. Instead, they've got more like nutritional imbalances. And I say the yellow is outside of the healthy range. So it's not optimum, and it's most likely a nutritional imbalance that's affecting how you are feeling. Of course, I want to know what the oranges are too. I look at all of it. Interpreting results. So using the NBChem lab report, I did identify several suboptimal patterns. You can order a functional health report through Avexia, which is great as a learning tool. I don't like to do it. I don't like to give patients the functional health report just because it's a voluminous amount of information and not all of it is clinically meaningful. However, when I was learning blood chemistry, I found those types of reports very helpful so that I knew what I was looking at. We did add a couple of tests to our standard panel since 2022, so let's go over what I ordered at that time, some of the patterns. First thing that you really can look at here is her immune system is stressed out. The monocytes are high, slightly, just a little bit, so that's usually a sign of persistent infection or some kind of recovery process from infection. But if it's high in people just on and on, that often means that there's some gut inflammation. Also, her globulin is slightly high. Globulin can go up if there's an active immune response because there's more antibodies, which are a globulin type of protein. That's possible, or it could be digestive dysfunction. Either way, I'm thinking immune system and gut. Then, looking at the inflammation markers, her ferritin's a little high. Now, Martha is a very small woman. She's only about 5'2". She's maybe 110 pounds soaking wet. She's very tiny. So I'm like 102 for ferritin on somebody her size and age. I'm thinking it's either some kind of inflammatory process, immune activation. I doubt it's a robust amount of iron. It could be just an iron overload. We'll have to look at what the iron pattern looks like. But I'm thinking inflammation from somewhere. And then her homocysteine is a little bit elevated, which is also a little bit interesting or out of what I would expect for someone of her size and age. So that makes me think there's some inflammation or some B9 and B12 deficiency perhaps. And there's those monocytes again. Oh, look at this iron. Her UIBC is 92. That is that's out of the lab range. And the percent saturation is also out of the lab range. Her serum iron is also lab high. Her ferritin is outside of optimal. She's got iron overload. So is this more of the classical hemochromatosis type iron overload, or is it more an immune inflammatory type of iron overload? We'll just have to see. Typically what I used to do with these types of patients is I would tell them to go give blood right away with a pattern like this, especially when the iron saturation is that high. I think, oh, you really need to go give blood. But I didn't for Martha because she sort of had just an overall deficiency type pattern other than the iron, and I didn't want her to become more deficient than she already was. So I am just watching this for now, and I'm going to work on the immune system first. Looking at the vitamins and minerals, what we see from the Sheehan standard panel, her B1 pattern is low, so I'll think maybe she needs some Cataplex B or something like that. Her B6 pattern, she's got maybe some low B6, because when the GGT is low like that, I usually think it's B6 or magnesium. But she's not anemic, and she doesn't have any type of B6 anemia type markers, so I'm thinking it's just strictly a nutritional deficit or B6 need right now. So I will muscle test that on her to see if she needs it. Her vitamin D is low, so that's very low. She'll definitely be getting vitamin D. I'd be very surprised if she doesn't muscle test vitamin D. This is what I'm thinking as I'm looking at this. And then her B9 and B12, I'm looking more towards this as being the cause of that slightly elevated homocysteine. The B12 being at 549, if you can see that right here, that is not good, especially in someone who is eating meat. To me, that means that there's some gut inflammation or they're just not absorbing their B12 for some reason. Now, there would be other functional tests that you can do to really track down specifically what is going on with like anti-intrinsic factor antibodies and things like that, but I'm not worried about that right at the moment. Instead, I'm thinking we'll probably just give her some B12 in the short term and then look into some of those other things later on. Her uric acid is a little low, so overall it almost looks like there's more of a B12 folate type deficit here or a slight deficiency, so I'll be testing those on her. And magnesium and zinc, she has enough magnesium according to the serum level. Again, it's not 100% that serum level, so I like using muscle testing as a backup. If I'm in doubt at all about the magnesium, I will always muscle test it, especially if someone is constipated like she is or she was. And the alkaline phosphatase can point to low zinc, so I will test that also. Here is an adrenal stress pattern. Now, of all the blood patterns that we have, the adrenal function pattern I think is, I don't know, I just like it the least because it's never a clear, nice, clear-cut pattern. It's always sort of murky. It's like, oh, what's causing those low triglycerides? It's not adrenals, and the sodium and the potassium, they can be out of range. It could even be dehydration because they're both just a tad bit elevated. It's not super clear, so I'll be looking at the other tests to clarify the muscle testing and the Ragland's test, which I'll go over in a second. Her initial assessment with nutritional response testing revealed immune stress in the parasite category. And in her symptom survey, she scored relatively high in the liver and gallbladder category, which confirms my suspicion about the gallbladder, that it needs support, especially with constipation. And she did have some hypothyroid symptoms also. So what is going on here? The parasite stress, liver gallbladder stress, hypothyroid symptoms, and the Ragland's test did confirm adrenal stress. So Ragland's test, if you're not familiar with it, is we always do 3 blood pressures for every new patient. It's part of our intake exam. We do 1 sitting, 1 lying down, and 1 standing. And when someone goes from lying down to standing and they're systolic, the top number does not go up 10 to 20 points, then I'm thinking adrenal stress. So if it goes up 5 points or 0 points, or if it even goes down, I'm thinking adrenal stress, and I need to find the way to handle that using nutrition response testing. Here's the course of Martha's care. Over the 12-visit program, we focused on reducing sugars to get her inflammation down, increasing protein to balance her blood sugar, and the nutritional supplement program included Zymex 2 for parasites, choline for gallbladder health, and adrenal desiccated for adrenal support. I want to back up. Increasing protein is to balance blood sugar. She did not have a blood sugar problem, but I would say that she did have an overall kind of deficiency type presentation, so I'm really looking at beefing up that person's protein intake for healing. And after the 12 visits, Martha did not continue care as her symptoms had improved, but they were to some degree still present. And she had become pregnant, and she was about 3 months, so she felt she could handle on her own from this point. 2 years later, she calls me again, because since I had last seen her, her symptoms had returned. She had given birth to a healthy daughter after she left my care, but then she was not able to carry another pregnancy because she had had one miscarriage in the interim. I did more blood work, and here's what it looked like. As you can see, the right column is April 2022, the left column is October 2024. You can compare it this way. I like to look at it just as a quick glance, but let's look at some of the patterns, how they have changed. The first thing is we do these food sensitivities now. We were not doing these back in 2022, and it's very interesting that the wheat showed up and also the casein, which is the milk protein. The milk protein is higher, it is more pronounced. So I'm thinking definitely there's some gut inflammation here, some perhaps leaky gut kind of driving this immune response, this immune reaction. And because she is a dairy farmer, I did not say you have to stop milk. I did work with her on stopping wheat, so she does not eat wheat currently. But as for the milk, my strategy here, especially for people who live on a dairy farm, milk the cows twice a day, they get the good raw milk from the special kind of cow. I just had her hold some good quality milk, and I muscle tested which digestive organ became stressed, and I also checked the thyroid, the liver, and gallbladder, and I believe I tested it against her adrenals. So I tested it against the milk, against all of the trouble organs or the suspected trouble organs, and I believe it was the gallbladder that reacted. So I just made sure that the gallbladder support that I provided helped to calm down that reaction to the milk protein. And so far that's been working pretty well for her. I think it's choline and Fenco that she takes. Now looking at this blood sugar pattern, there is no high blood sugar pattern. There's really not like an insulin resistance issue here. What you're looking at is more of a hypoglycemia pattern. That fasting glucose, I wouldn't really call it low. It's a little lower out of optimal range. It's not lab low. The fasting insulin was lab low, so I'm always a little bit like, what's going on with these people that have a fasting insulin of 1? Are they just not ever eating, or what is going on? It could be brain stress. It could be that pancreas just needs some support to produce more insulin. Could have something to do with the adrenals. I let muscle testing help me to work all those questions out. Here's some more information about her immune system. Interesting how her pattern has changed. Her white blood cells, I think before they were like a 5.8, now they're a 4.5, so they've gone a little bit out of optimal range low. The monocytes are slightly up. So to me, that means that gut inflammation is just continuing. Maybe it was better for a while and it has just kind of come back. The white blood cells going down is like either some immune suppression, or it could be a nutrient deficiency affecting white blood cell production, which can happen, especially if the person is low in zinc. So I will test zinc on her. I don't think she did test on zinc, although I think there is some zinc and chromium complex. I'm not 100% sure. But interestingly enough, all of her old inflammatory patterns have gotten better. So the ferritin is down to a normal level. CRP was never high, but her homocysteine is down from like 8.5 or something to 6.9, so that's normalized. And if you remember the way her fibrinogen looked before, it was like 299, so it was right on the borderline of out of optimum range. Now it's 269, so to me that's better. Interestingly enough, the globulin is also better, so does that mean not as much immune activation, or what that means exactly isn't 100% clear, but it's something with the digestion or the immune system that has improved. Maybe the liver. Here's her iron pattern. The UIBC is now better than it was 2 years ago. Same with the serum iron, it's down. The percent saturation is also down. So this is still a mild iron overload type pattern, but it's definitely not as bad as it was. So to me that means something's going right. Should still go a little better than it is. She has developed a mild anemia though, and that I'm not sure exactly what is causing it. So we're gonna let muscle testing help me figure that out, because she doesn't fit any of the nutritional anemia patterns that I would typically look at, like low iron or low B6. Anyway, if it was low iron or low B6, think with me for a second, that would cause the MCV to be low, more so. But here we have a higher MCV, which you would think B9, B12 would cause a MCV to go high, but her B9 and B12 are sufficient now, and also that homocysteine has also gone down. So I'm thinking this is not a B9 or B12 problem. It could be more of a thyroid stress here, or perhaps more from the immune system. I'm not sure, but we're gonna just monitor that. Here's some highlights from her nutrients. In some ways it looks better, in some ways it doesn't. The B1 pattern is largely the same, so I'm still thinking maybe she could use some B complex or cataplex B. Her B6 pattern also is about the same. The GGT has gone down a bit, which I know I usually think there's some deficiency there, maybe B6. The hemoglobin and hematocrit slightly on the low side. It does fit the B6 pattern, but this is how I look at this. If it's not a low MCV, then I don't really take into account that hemoglobin and hematocrit. I mainly just look at the nutritional levels, which would be the AST, ALT, or GGT. The vitamin D level is better than it was, but it's still too low. Looking up here at the B9 and B12, this, I just went over this. It looks better because the B12 level is better, the folate level is better, the homocysteine is down. The MCV is up though, which does fit a B9 and B12 anemia pattern, but I just don't think that's what it is. So I'm not sure what this anemia is about, but we're definitely going to work on her immune system like we did before, and also still work on her digestion. The magnesium and zinc, again, that serum magnesium is a 2.1. Some people like red blood cell magnesium. If I'm in doubt, I like serum because it's a little cheaper of a test, and it's based on population studies. I tend to think if there's any doubt at all about the magnesium, just muscle test if different forms of magnesium on the person to see which one, if any of them are going to work better, especially if they're constipated. And the alk phos again went a little lower, so I'm thinking maybe there really is a zinc need here, so we'll see. Again, a mild adrenal stress pattern. It's a different sort of adrenal pattern than 2 years ago. It was more of a dehydration pattern 2 years ago, but now it just, with that potassium being just a tiny bit low, I'm like, what is, anyway, it's not clear. Adrenal patterns, I don't like them. It's still something going on with the adrenals. So my strategy here is going to be to perform the general adaptation syndrome muscle test, which we do go over in our adrenopause presentation, and we'll test the adrenals directly and handle it. If I wasn't muscle testing, I would make sure to give some kind of adrenal support, especially if the symptoms match up, which for her they did, the energy. So what can we see from the blood analysis? There is a hypoglycemia pattern developing. She has food sensitivities to wheat and milk. There is some persistent infection in the form of elevated monocytes. Iron overload persists, but it is improved. It could be that immune-associated iron overload that I was talking about. There's a mild anemia developing. There's a mild-looking adrenal pattern. And remember, a mild-looking adrenal pattern in the blood is usually a little bit more severe than mild because of the tight regulation on blood sodium potassium levels. MCV is higher, but it's not clear why. And she does look low in some nutrients, which I will muscle test. Muscle testing, nutrition response testing revealed a gut flora imbalance, food stressors, and adrenal and gallbladder stress. Continuing the program the second time around was really quite similar than the first time around. I did add more pancreas support in the form of standard process chromium complex and Paraplex to help with her blood sugar balance. I believe she also had choline, Fenco, and some kind of a probiotic. I forget which one, but it was the one that tested. And then also, I believe, some desiccated adrenal for her adrenals. And what has the outcome been? Oh, and I also had her avoid wheat, cut back sugar, increase protein, and what else? Yeah, eat for blood sugar balance, like, protein snacks and things like that. Eat within a half an hour of waking up. That's also important. I did not want her going out to the barn and working for 2 hours without having eaten something first, which she had been doing. So here's the outcome. Her response to care. A month or so after starting on her nutrition program, Martha was able to conceive. Her midwife then wanted her to stop the Paraplex and chromium complex because of the hormone ingredients. I told Martha, this is my approach to this. I said, please just listen to your midwife. I'm a nutritionist. You got to make your midwife happy. So in spite of the fact that I was very clear to explain to her that standard process products do not contain hormone ingredients, however, she should just stop taking them for now because that's what her midwife said. And Martha appreciated that. She did stop, but then a couple weeks later, she started back on the chromium complex and Paraplex again because she felt so much better when she was taking them. Currently, she's 7 months pregnant. She's doing well. Her energy is okay, not great. Her abdominal swelling is fine if she makes sure to eat enough, and protein too, when she gets hungry, and avoids foods she's sensitive to. So that is a concern of hers, that she's sensitive to so many foods she can't handle, just eating wheat or lots of nuts. Certain nuts she reacts to also, but I told her I do suspect some kind of parasite or deeper gut pathogen that could be causing this, but I'm going to have to do some resonance testing to uncover that. I don't want to do that until after she delivers and is finished breastfeeding. And that is what it is like working with these types of patients. You just have to do the best you can. It's not a perfect world. You can't just jump right in there and start, giving them all kinds of parasite cleanses and things like that. You have to just go slow and gentle and really work on building up the body with the nutritionals, which is the standard process side of things. So to order labs through Avexia, you can scan this QR code. Your enrollment fee will be waived. You can access our custom lab panel so you can start ordering immediately. And you'll also have access to the discounted pricing and even an additional discount with this QR code. And you'll be able to access the functional health report through Avexia as well if you sign up for Avexia Complete, which is a $50 annual fee. There is a course on blood chemistry. It's called NBChem. And we do in-depth teaching on each lab marker. We do a thorough review of the top 4 most vital nutritional blood patterns: food sensitivities and digestion, insulin resistance, immune stress and inflammation, and iron balance and anemia. That way you can start using this material and ordering lab tests right away to help your patients. Thank you.